Over the past 2 years, I've been helping students pass the NCLEX exam in 85 question. Right now, what I've seen so far so good is that I can get in a week I can get 100 messages, right? And then everybody are like, I want you to help me. I want you to help me to pass the exam. Now, the truth is that a lot of students will say they want help, but they don't really need help. They just need something in particular. Now, this is it. I feel in order to pass a specific exam, one, because as a coach, different from program that is just going to dump a lot on you, as a coach, I can easily assess you, right, to see what you need. The moment I'm able to assess to see what you need, I can easily know the problem. I'm diagnosing the problem to create a plan for you. Now, let us implement that plan and evaluate. Now, what question bank program is missing is that they don't have the ability to assess you. Even if they use question to know where you stand, you all the only thing you have right now is the percentage of readiness. Either you are high or very high, right? Which is not enough to create why you are not within this range in those question bank program, right? Because now, yes, you might not be high as at yet, you might not be very high, but at least you need to know the reason why you are not at that point yet, right? But now you have to start figuring all those things out yourself to know why you are not out. And this is what a coach can do for you: assess, diagnose the problem. Now, due to that problem, you'll be able to get a plan. That's what your question bank don't have as well too. Creating a plan, then watching you implement those plans, and at the end of the day, evaluating the plan. Your question bank program don't have this. That's the reason why you need a coach. Now, this is it. A lot of students message me and they will say, I want you to help me, coach. I want you to help me, coach. But they are not ready to help themselves. Now, there was a particular student, right? I'm learning, I started this 2 years ago, so I was learning, right? Now I was learning the student. Now, this particular student said they want me to help them, and I gave them something for them to study. Now, 2 days later, I asked her, right? Have you done what I asked you to do? You say, not really. I open it, but I will do it today. Yeah, I've been so busy and this. I said, okay. Now, it has been happening like that. Most people, they feel like they can leave some things for what? Later. Now, I started learning about a lot of students. I said, this is common. Now, let me do something differently. I said, okay, if I'm going to ask students if they have covered a specific material, which I sent to them, what I'm going to do this time around is to ask them, have they covered it and what have they studied previously before? So now, a particular student also messaged me again. She was like, oh, I want you to help me. I said, okay, I'm going to send you stuff. I sent her stuff, and then she I even asked her to the point of asking her when we should be able to cover those materials so I can easily test her on it. She said, okay, she should be done in the next 2 to 3 days. Okay, I gave her 3 days. The third day, I reached out to her. And then I asked the student, are you done with it? She said, not really. I covered this, but if you can give me to so that I'll be able to cover it. I said, all right. And then I said, all right. Apart from what I asked you to study, right, for that 3 days, right, what have you been studying? Now she started opening up. She said, I studied this, I studied this, I studied that. Now I told her, if you avoided all this and focus on what I asked you to study, you would have completed it. So you did not find this important, but you find this what important. She said, yes, it's because she don't really know this. That's the main reason why. Now, a lot of students will message you to help them, but they are not ready to follow process. Those kind of students, they are not a good fit for me, right? And I will definitely know, because if I ask you, are you committed to the process? Are you ready to pass? Right, everybody will say yes. But are you committed? Are you ready to do the work? That is where the problem is. A lot of students are not ready to do the work because they are looking for shortcut to success. That is what they are looking for. That is the reason why you have students failing the NCLEX exam multiple times and they will have to blame program. Whereas they are the reason why they keep failing the exam. Because if you are using 7 to 10 different programs and you are still failing the exam, let it make sense to you. Is the program the reason for your failure? Obviously, it is you. Because you studied everything and at the end of the day, you still failed the exam. Meaning there are some things you don't know about the exam. The moment you start knowing about the exam, you start having an idea of how to pass. Now, let us say let us say I'm about to like maybe take a little break from where I'm staying. Let's say maybe I'm leaving Naples, right, and I'm going all the way to Miami, right, and I don't know how to get here. It makes no sense. I begin on this journey when I don't even know anything about Miami, right? I cannot just go to Miami like that because I don't know anything. I need guideline before I can navigate myself to Miami. And one step is to understand what am I doing here. Two, and I need to get direction, which is from the Google map. That way I'll be able to navigate myself. If I start hearing people, oh, Miami is this, Miami is that, if I don't experience it by myself or know related information to those experience, I will not be able to enjoy the process. Same with the NCLEX as well too. You can easily use different material to study for the NCLEX, but if you don't understand the NCLEX yourself, you will still fail the exam. You will still what? Fail the exam. So in order to pass the NCLEX exam, you need to what? Be committed, be ready to do the work. NCLEX is not easy. Right? Passing the exam, yes, after doing all the work, trust me, yes, you can easily pass it, but the process is difficult, right? Because yes, this is you feeling like you are ready for the NCLEX exam, but this is a whole load for you to what? Go through before you end up what? Becoming what? A registered nurse. But think about it, the result. Now, I'm not that kind of person that look at you and I will say, okay, in as much you are paying me $497 for 8 weeks coaching program, that is the reason why I should allow you in my coaching program. No. Aside paying me this amount, I also want what? The result as well too. So I'm after the result. I've been doing this for 2 years. I've helped 700 plus students pass the NCLEX exam, right? And all I'm after is the result, because this result helped me to create more awareness to what? Students that are giving up. Every time I cry for most students that what? Give up, because this is the reason why I started this complaint in the first place, in order to help students that are giving up. Because now, last year, right, 2024, 94% of students passed the exam, right? That is 186,000 plus students were registered nurses last year, right? They were registered nurses last year, leaving only 6% of students failing the exam. So the passing standard, or the passing, let me say, the pass rate is very high. So a lot of students are passing, but look, this 6% students are failing, and this 6% students, when they repeat the NCLEX exam, they struggle, because people that repeat the exam, only 35 to 37% pass on their very next attempt. Unlike first timer, right? Someone that is taking the exam the first time, this is their pass rate 94%, 88 to 94%. Unlike people that are repeating the exam, this is what you are struggling with. So the chance of passing the exam again is low. So you don't want to keep making that same mistake again. So it's not about program now, it's about understanding yourself. The moment you understand what you need, right, you'll be able to pass. Some people feel like this is what they need, they get what they need and still fail. Now they will say, oh, I joined a particular program, I requested for this, but I still failed the exam. I feel like the exam is not for me. That's a lie, right? Or nothing is not for you. That is a lie. You need to understand one thing. You don't get what you want, you get what you need, right? Because people think, oh, I want this, but you don't. That is not what you should be getting. Instead, you should need this, right? If I'm explaining right. Now, some student will say, oh, I need strategy. Now, I've given a particular student strategy. Okay, apply the strategy. She cannot apply it because the knowledge is missing, right? The knowledge is missing. The moment you don't have the content knowledge, you cannot apply strategy. Let it make sense to me. Airway, breathing, circulation is a particular principle. This is not a strategy, it's a principle. A lot of students mistake it for strategy. Strategy is when you are bypassing a process in order to make something easy for you, right? Principle is an existing process that you need to apply it anytime you think about that specific thing. They are standard principle. When you are trying to do prioritization, this is your standard principle for most prioritization questions. This don't apply to every prioritization question, but it applies to specific type of question. When you think about this kind of question, you apply ABC immediately. Airway, breathing, circulation. That is a standard principle. It's not a strategy. A strategy is now when you are trying to like bypass this process to find a different way to still answer that same question using what? Strategy. If this principle is difficult for you. Now, hope you understand what I'm saying. Now, listen to me. Now, if you know airway, breathing, circulation, now the knowledge required to use this is that you need to know situation that fall under airway, you need to know situation that fall under breathing, you need to know situation that fall under circulation. Now, this particular student saw a particular question which said dyspnea with exertion, and she saw a patient that have heart failure and they are anxious. Now, Dyspnea with exertion, yes, the patient have difficulty with breathing, but the reason why they're having difficulty with breathing is because of exertion. The moment this patient can rest, this patient will be fine. Now, the content knowledge is not telling her that this is not priority, but her senses is telling her that, oh, this is airway or breathing problem, so this is priority to her. So she selected this over heart failure. Right, she got the question wrong and she was like, but that is airway or breathing problem, so why am I getting it wrong? Because the content knowledge is that she needed to have is that there are various reasons a patient might have difficulty breathing. If you are exercising, yes, you can have difficulty breathing. If you are doing stressful activity, you have difficulty breathing. If you are doing exertion, you definitely will have difficulty breathing. So, but if you have chronic condition, maybe like COPD, asthma, pneumonia. Pneumonia is not a chronic condition, right? But we have different chronic conditions, right? And acute condition that can cause what? Difficulty breathing. So if the difficulty breathing is directly related to this condition, then fine. A patient can have COPD. A patient can have COPD, right? And have dyspnea, right? With exertion. Now, these patients have COPD, but they have dyspnea with what? Exertion. So the NCLEX is telling you that this dyspnea is not happening because of the COPD. Instead, the dyspnea is happening because of what? The exertion. So despite the fact the patient is having COPD, does not mean the dyspnea is happening because of the COPD. You need to pay attention to where NCLEX is directing you to. Because NCLEX is directing you to the fact that they don't want you to think about it. The dyspnea is occurring due to COPD, but it's occurring due to the exertion. But if the NCLEX do not include the exertion, then we can 100% believe that this dyspnea is occurring due to what? The COPD. Am I making sense? So these are the earlier knowledge you need to have before you can have the ability to apply airway breathing circulation successfully. But now, guess what? This patient is having heart failure. Now, this lady cannot really think about it, right? And understand that a patient that is having heart failure and is anxious, that is a sign of what? Low oxygen. Now, the content knowledge that she have is that she need to see where the NCLEX put 91% oxygen for her to think about it that this patient is having low oxygen. Sometimes there are some things that scream low oxygen. If NCLEX tell you a patient is restless, it scream low oxygen. If the NCLEX tell you a patient is confused, sometimes it scream low oxygen. If the NCLEX tell you the patient is anxious, it scream low oxygen. So that is where she's supposed to be thinking the airway. So the real airway and breathing problem is even this instead of this. You can see, you can easily understand a particular principle or what you know as strategy and don't still be able to apply it if the knowledge is not existing. And that's the reason why I encourage students to know the knowledge, because most students, what they learn right there is quick fat, something that they can memorize that is not helping them to critically think what the examiner is trying to test. And that's the reason why they end up seeing similar content on the exam, but they still fail the exam. Somebody was just crying to me yesterday and she said she knew all her question, but she still failed. Now she's about to give up. She don't know what to do. Favour, help me. Right. I know a lot of people are in this kind of situation and I'm ready to help you. Now, I said previously before, my coaching price is $497. Right. I offer this. If you're interested, you can join the coaching program. You can either pay in full or I offer payment plan as well too. All you just need to do is to pay put a down payment of $250 and then tell me when you are going to pay the next $250, right? It's a 8-week coaching program. All I do within this 8 weeks coaching program is the first 4 weeks we do content, right, for 30 days, which is also 4 weeks, right? Next 2 weeks we answer what? Questions, right? And the last 2 weeks we do strategy, right? We do strategy for the last 2 weeks, right? So this is how my coaching program work. For the question, I give you readiness assessment. I expect you to meet 60 to 90%, right? Here. If you meet this, I believe you can use content to answer question on the NCLEX exam. Now, when I introduce strategy, I'm going to give another readiness assessment. Now, if you meet 75 to 95% pass rate, then I believe you can use what? Strategy and content to answer NCLEX. At this point, I believe you are 100% ready to pass the NCLEX exam successfully, and you are going to pass the NCLEX exam. Listen, I created this company to help students like you, students that are struggling. Remember, a lot of students are passing, but me and you know, you might be struggling, you failed countless times, you felt giving up, you are wasting money, you are wasting time, because it's not only about wasting money. Money is even the smallest thing. Timing is another thing, right? Timing is another thing, right? So a lot of people are wasting time, right? So guess what? I will help you to pass the exam successfully. All you just need to do is to reach out to me. Let me put my phone number on the screen. Just text me +17676130769. So text me +17676130769, and definitely by the end of 8 weeks, you are going to get what? Your license, and you're going to be a registered nurse or a licensed practical nurse. So I will see you on the other side.